All right, ladies and gents, we're back. So we're going to review these two lectures now. This first one is the introduction to the public health approach, and it's very similar to the exam. You're looking at a public health definition. So understanding that public health is important, as I explained in the first in-course assignment, um, how it uses all sorts of techniques. It uses a community approach as well to ensure social actions to ensure that the overall general health of the public is restored and is well taken care of. So public health looks at problems that are occurring regularly and apply solutions to those problems to reduce the loss of life, to reduce the unfortunate loss of life, especially when it's happening, or it can have effects on a large number of persons, or it's happening too often. So, public health. The example that was looked at in this first lecture was drowning, and they use a public health approach to drowning. Similarly, right here locally, we can use a public health approach to road accidents and what are some of the causes of road accidents in our country, especially. Let's just say, for example, we could generalize it. What are some causes of road accidents? Is it because persons are speeding? Is it because persons are not um, being monitored with the presence of police? Is it because of weather conditions? Is it because of road infrastructure? All of these things can be looked at into why there are a number of road traffic accidents that lead to disability or death of some of our citizens. And this is something that is actually an issue I believe should be looked at because we do have a relatively high number of road traffic accidents that lead to the unfortunate demise of individuals, persons, loved ones losing their lives and causing distress and mental trauma to so many families. So, the example that was used in the lecture was about the pool, the pools that are available in people's houses. It looked at the time of the year that these drownings were occurring. It looked at the age group of the drownings. It looked at what was happening around the drowning. So the public health approach is, the questions are: what is the problem? What are the risk factors to the problem? What works? What can work? And go about implementing that and then monitoring and evaluate. All right, so you need to collect and analyze data, define the problem, or outline the problem. Is the problem preventable or not preventable? Is it controllable or not? And a public health approach requires a plan, and we all know from our course in farm admin and these courses, a plan is a blueprint. A plan has specific steps that take us into a particular direction. A plan tells us about getting to smart. Uh, just 1 minute, 1 minute, okay? right? It requires a plan, a champion, a strategy. And remember, we talk about what a champion looks like. It's a person who talks, breathes, who walks the talk, who's always pushing forward for the public health intervention, a method, a will, and funding. The will, of course, as we all know, is political will, and the funding can come from your local agencies or from international agencies as well. Another thing that we can look at a public health approach is the weather. We have weather systems that affect us. We are a Caribbean island that gets hit from um, tropical storms from time to time, and we do have some issues that come up, some flooding issues that come up. We don't have much loss of life, but is it that we do have an increase in certain number of illnesses, and how can utilizing the weather report be important for us monitoring the health of the public, and what steps can be taken to take a look at the common illnesses that are happening at more frequency, whether be it viral, whether be it respiratory type illnesses, whether it be visual issues, and sometimes something as simple as the weather report can help aid in understanding, um, in helping to create or develop a public health approach to a particular problem that's weather related. All right, so there are two examples here. I spoke about the road traffic accidents that can cause death or damage, permanent damage to person's life. And then the issue of the weather and how the weather can have effects on our um, ability to get back out here and to be productive. How is weather patterns and weather systems affecting us and causing disease? All right. So that's your public health approach. You just do it. We looked at the Arizona drowning, and they did stuff. They made these interventions. They put the barriers. They put legislation in place that children can't get to it, and it has succeeded. The number of drownings reduced significantly. But then drownings shot back up again in some years passed by, and that was because there was a failure to monitor and evaluate. There was a failure to maintain and to continue the process that was being done. Perhaps the laws that were created were sunset-based laws, meaning laws that didn't have everlasting effect. That lost their use after a certain amount of years. So a public health approach requires monitoring and evaluation. And I go straight back to this slide, slide number slide number 17. What is the problem? Identify the risk factors. Evaluate what works. Being pragmatic. I use the word pragmatic there. Evaluate what works, because I can say ad nauseum until I am fed up that there were certain things that was working in certain areas of the world that simply weren't adopted in other parts of the world that led to the unfortunate deaths of so many persons. What works? We know masks were working, but masks weren't being applied across the board in time in the Western world. Huge failure on our part locally, huge failure on the other international countries on the Western parts of the world. Implement, how you go about implementing, and finally monitoring and evaluation. I cannot emphasize this enough. All right, good. So so that was your lecture on public health approach. um, I will now review the lecture on ICT, and I noticed some of you used in your exam the notion that ICT promotes liberation, and that's very good. ICT removes barriers. Essentially, that's what we're talking about. ICT removing barriers that can lead to inequity. ICT removing barriers that allows for equality only, and we know that equality doesn't always help those that are vulnerable. Understand that we have to always look at the vulnerable sector, the vulnerable group of persons that require the assistance to be able to move forward. So ICT talks about ravaging epidemics. We are in a pandemic. Forget epidemic. We're in a pandemic. Social, natural, and social calamities. High level of infant and maternal mortality. We have that issue here in Trinidad and Tobago. Low level of life expectancy, deteriorating health facilities. ICT helps with all of these because there's an increase in demand for funds for physically building healthcare structures. And if we apply ICT, we may not have to be spending money on brick and mortar. We can spend money on getting an infrastructure, an ICT infrastructure that can reduce the need for all of that brick and mortar. Helps with research, helps with training and training your doctors and your medics, training your healthcare professionals. So ICT provides helps services in the health sector become fast, to become efficient, and to become cheap. ICT can be applied when there are shortages of qualified healthcare professionals, and we use the example of radiology, where radiology is now reporting on radiology is now outsourced easily. For those who can pay for it, outsourced easily to India and to other places that can read electronically a scan, and the report is sent back. ICT helps with promoting better self-care, and I want you to tie that in with that last lecture we did of self-management. I want you to tie that in with COVID-19, where you are now promoting better self-care because we don't want to have to unnecessarily physically interact with persons. All right. So this is where I was coming at with the exam, providing professional support. So ICT applications are your EMRs, or electronic medical records, your hospital information systems, telemedicine, community health, expert systems. Expert systems meaning your different clinical expert areas, your intranets, public networks. ICT is flexible, it's interactive, can reach a large population with small amount of resources. Um, It maximizes the use of scarce knowledge and limited resources. ICT helps to level off the urban versus rural disparities, right? By remember, rural communities, generally speaking, are those that have large distances that separate where people live to where health facilities are located. So the access to it sometimes is different. Remember, in this public healthcare, access to healthcare is important. So ICT helps to decrease that gap of urban versus rural access to healthcare. ICT helps with primary healthcare to provide a more equitable approach to healthcare. It helps with recording information for epidemiological surveillance to have better data collection and promotion international exchange of information. Right, so ICT is something that should be applied, that we would hope can be applied more and more, not only in public but also private healthcare facilities, and there should be better integration amongst these facilities and within large organizations, as said in the first exam, for better use and better application of your health related um, attempts. So that was your ICT lecture. Let me see if we can probably squeeze in another one if we can. Let me see. So we have funding, we have human resource, we have primary healthcare, we have self-care. So yes, we can throw in funding here one time. Let's just review how is healthcare funded. And in this lecture, we looked at all, sorry, I was supposed to ask any questions so far? Any questions? Any queries? All right, so no questions so far. So we look at the healthcare funding, and just as we said in the exam, we have to look at demographic changes and disease burden and epidemiological transition. These things are important to note. Healthcare financing can be national, it can be public-private mix, it can be community-based, and we want to ensure that um, these initial slides look at epidemiological transition as well as demographic transitioning. So health financing on slide number 12, you have the revenue collection area, the pooling of the risks in the middle, and then how do we go about purchasing? What mechanisms do you use for purchasing? Is it purely governmental agencies? Is it the social, the Bismarckian or the employer-employee related funding? Is it completely out of pocket? An individual goes out here and pays for medical insurance. Is it out of pocket, meaning you go to a health facility and you pay cash? So all of these make up the different ways in which healthcare is purchased. And I want to remind everyone that healthcare is not cheap. Healthcare is not cheap, and we know that our health surcharge that is that is taken out of our salaries. When you do get salaries, you'd see health surcharge taken out every week. It's a drop in the bucket. It's a bit of vapor as to how much it costs to actually produce healthcare and to get proper healthcare for so many citizens. And the risk pooling part is we're looking at the different age groups and their ability to produce income. And the persons who are young, they're not able to work. So therefore you need to find subsidies to cover the cost of it. It may be parents, it may be insurance. And then as persons get older as well, that's where there's another need for subsidies because they may have a limited amount of pension that would afford them a certain amount of a certain lifestyle. And also as persons get older, they now have a higher increase in cost because as you get older, naturally you develop more illnesses and more diseases. So then you're localized to a certain pension, and now you have more illnesses coming up. So that's where the risk pooling comes in. So you look at the National Health Service, Social Security, voluntary and community-based insurance. So we want them to describe each of them. And I want you to consider as well this slide on slide number 23, aspects of the healthcare market to be controlled. There is something called consumer moral hazard, where perhaps you're not paying for an item, then you might use it unnecessarily, right? Adverse selection, the process where the best risk individuals are selected, where only persons who seem to be very healthy are selected to be part of the medical care. If it is you're very sick, they may deny you medical care and you may have to only accept whatever you get. And then there's the provider moral hazard, where um, providers are incentivized to lean towards a particular type of treatment. So consumer moral hazard, provider moral hazard, and adverse selections are aspects of the healthcare market that ought to be controlled. And we know we're looking at right now, there has been this um, this Venezuelan child is making the rounds that requires treatment, costly treatment, and our RHA down here have have asked the persons to come up with the funding to get the treatment. And this is a humanitarian issue, but it's also a health economics issue. How do we how do we go about fitting the bill constantly for persons who are not not contributing to the funding of healthcare? And this is a controversial topic, but it's a topic that needs to be aired. at the end of the day, the healthcare must be paid for, whether be it equipment, whether be it professional attention, or whether be it supplies. Someone has to pay for it, and yes, as much as we can appreciate it's a human being, it's a human being that we want to help save. We don't know what this human being can become in the future, but what mechanisms are being put in place to cover for that healthcare cost? Is it that all of the healthy persons who are wealthy can now cover it? Or should we be going in the direction of all of these GoFundMes? And these GoFundMes have proven to be very beneficial for Mr. Fabian. And even when he got his monies for the bank, I put in his comments, I hope that he can now use this platform to promote the same GoFundMe for kids like this Venezuelan kid who requires treatment and does not have the funding. So healthcare funding is something that's controversial all over the world. There are a mix of ways in which it is paid for, whether it be purely from the government, from taxation, whether you pay for it privately or from an individual base, or whether you are paying out of pocket, or whether it's a community-based type insurance mechanism. All right, so those are the reviews of the three lectures. I hope you all would have paid attention. I may or may not have given clues regarding your exams, and I invite questions now from everyone. Questions or queries? Any questions? Any queries? No questions, no queries. Sabrina, when would we getting the lit review? The lit review. Sabrina, are you in class on a Monday? Yeah, on a farm admin as well? Because I said it in farm admin next week. Lit reviews are going to be coming, and on the let me just get the dates here correct again. The lit review should be for next week. You'll have 2 days. Okay, so you have 2 days. You'll most likely have 2 days to get it done. And your second in course should be in the week of the 16th. So let's review next week, second in course on the 16th, final exam in the week of in the first week of December, or the second week of December. All right. Any more questions from anyone? All right, so if there are no questions, I want to congratulate Sarah and Jahila again for doing well on their exams. And I encourage everyone to share their knowledge and share their approach and work together. I believe, the lit review is supposed to be done in pairs. So I'm asking everyone to pair up and send me the list. I'll send a WhatsApp to everyone so that they will know to start pairing up now and send me the list. So when I correct it, I will be able to put the grades for everyone. Okay? All right, so that's it. If there are no other questions, I will end the stream and we shall see each other next week. So long. Take care. My WhatsApp is available should you all want to discuss anything after the lecture. All right?